until the 31st of May 2020 and May 2020. Now, we have been examining the impact of the measures generally on the economy. And there are some measures which have had considerable economic impact. We are absorbing these impacts because we want to contain, first and foremost, but strategically to control the spread of the disease. The truth is that the measures have been very effective in controlling the spread. As I pointed out earlier, without the workplace outbreak, Jamaica would be on a 20-day doubling curve. Generally, the curfew hours have worked very well, but without doubt they would have had an impact on, for example, the quick service industry, the fast foods and so forth, the restaurant industry, for example. The curfew measures, however, by virtue of limiting movement, would have significantly curtailed the spread of the virus. And we will be contemplating adjustments to the curfew hours, but again, it all has to be based on what the science is telling us, what the public health advice is, and we have to weigh that in the balance of what is in the public interest. So we have started to promote the reopening of certain sectors fully, because Jamaica has never really closed its economy. So last week, we announced the exemptions for the agriculture sector. We expect the agriculture sector to turn out in full force. We have announced the exemptions for the construction sector. Today, letters were sent off to all ministers and all the ministries under the Ministry of Economic, all the agencies rather, under the Ministry of Economic Growth and Job Creation, that all backlogs of approvals, permitting, that the effort must now be made to bring those forward and increase the rate of approvals for projects. We need to get our economy started again, resuscitated, rearing to go again, even in COVID. But we will do so in a smart way. We will do so in a measured way, and we will never sacrifice the public's health. At this point, I'm going to invite the Minister of Health to give us his regular briefing.
Thank you, Prime Minister. Distinguished colleagues, ladies and gentlemen, one and all. The following is the update for May 4th, 2020 on the state of the COVID virus and the response here in Jamaica. So within the last 24 hours, I'm pleased to announce that we have had only 2 confirmed positive cases of COVID-19 in Jamaica. So this brings the total to 471 confirmed cases on the island. The 2 new cases are 1 male, ages 12, from St. Catherine, and 1 female, 20, from the parish of Clarendon. Both are contacts of confirmed cases based on the contact tracing. There are 221 confirmed COVID-19 cases related to the workplace cluster in St. Catherine, which constitute, of course, the majority of cases that we have had to date. At this time, there are 35 imported cases, 168 cases that are contacts of a confirmed case, 9 that are local transmission cases, not linked epidemiologically, and 21 221 are linked to the workplace cluster in St. Catherine, while 38 cases remain under investigation. Some 291, or 62% of the confirmed cases, are females, and the balance, 180 or 38%, are males. And the ages ranges from 2 years to 87 years. 11 more cases have recovered from COVID-19, bringing the total to 49 recoveries. So we're certainly seeing an increased number of recoveries, which is a very positive development. So we now have 49 recovered cases, and unfortunately, of course, we have 9 deaths. Just to reinforce what the Honorable Prime Minister said earlier, which is that we have seen a surge in cases in the last few weeks, but that surge has been linked to one particular cluster. And I'm sure the CMO will speak more to this. That surge does not represent the surge that we had projected or predicted, because it is not the sort of random, wide-scale cases that you would observe that are unrelated to travel history and that would show up across the country. This surge was created by one entity where there were issues, and that one entity has contributed fairly significantly to the numbers as outlined earlier. To date, we have identified, however, speaking now to the more random cases, some 36 cases through the respiratory surveillance system across the island. These cases have been identified in all parishes except Hanover, Westmoreland, and St. Thomas. And it is a reminder to the country, or should be a reminder to the country, that that surge is still likely, still possible, and therefore we cannot let down our guard as a people, as public health officials, as individuals going about our regular business. And it is a reminder to continue to recognize the advisories, the new rules of engagement, the wearing of masks, the social distancing, the proper hygiene practices, because we do expect that over time, living with COVID is going to mean that it could be anywhere at any time. And as a consequence, we all could be at risk in our particular location, wherever we are in the country. This is very important. It's also important that the country continues to support the efforts of the medical team in the field, the contact tracing, which is quite labor intensive and depends significantly on the support of persons at the level of the communities. When questions are asked, when information is solicited, that we cooperate with the team out in the field. I want to say a little bit on testing. So far, we have done some 5,830 samples have been collected and tested. Of the 5,830, 471, as outlined earlier, have returned positive results, some 5,320 negative results, and 39 are pending currently. This, again, is worth noting or emphasizing, because over the past 2 weeks or so, we have seen a significant increase in the number of testing that we have done. And I know it has been a concern among some persons within the population. I would like to just emphasize that the team, both at the National Influenza Center at the University Hospital of the West Indies and the National Public Health Lab, downtown Kingston, have been working and utilizing the additional technology to do a lot more testing. In fact, some 615 samples were tested in the last 48 hours, 436 at the National Public Health Lab, 179 at the National Influenza Center, which represents a significant daily increase We were doing an average of about 90 to 100 per day. We're doing multiples of that now, which is a very positive thing. Jamaica is now current also with testing. So we no longer have backlog of testing. Some time ago, last week, I had indicated that we had some 600 or thereabout samples. We have been able to cover that backlog. And so some of the concerns that have been raised around late notification of testing or tests that have been done, we should be in a position now to overcome that, which will mean earlier results. So appropriate action can be taken as it relates to those particular results. So we are now current as it relates to testing. In terms of quarantining and isolation, there are 454 persons in isolation and 76 persons in quarantine in a government facility. The final point I want to raise before I hand back to the Prime Minister is the issue around private hospitals and nursing homes, which have dominated some public discussion in recent days. We have accepted that inspections are necessary, are required, and I've asked for those inspections to commence forthwith. So the Ministry of Health and Wellness, through its Standards and Regulations Division, is now working to expand and to increase the the inspections, and provide appropriate guidance to these two sets of institutions. We have a team from the Registrar of Health Facilities and Monitoring, together with representatives from the Standards Research and Development Branch, Pharmaceuticals and Regulatory Affairs Branch, Microbiology Health Facilities Maintenance Unit, and specialist trained healthcare professionals and or public health inspectors. Now, we have not expanded our capacity of these group of specialists, and they are very much engaged in the COVID response. So it is a challenge, but I think there is a gap as it relates to the audits and inspections that we have discussed, and particularly as it relates to our nursing homes, where we have older population, persons who have underlying conditions for the most part, and it represents part of our vulnerable communities within the society that we need to manage carefully. Some persons may have been alarmed at the number of nursing homes that are actually registered as opposed to those that are not registered. The reality is that a number of the unregistered nursing homes have been inspected, but they do not meet the requirements of registration. And it is not that the team has not been working with them. Indeed, in the last fiscal year, 164 monitoring inspections were done and 118 registration inspections. So the work continues. It's been a long, ongoing challenge, but we continue to ensure that we provide the appropriate information and support. And in the context of COVID and the risks, the public health risks that COVID poses to the population, and in particular to vulnerable populations, as persons in nursing homes represent, we will make an extra effort to establish some basic protocols, whether they are officially registered or unofficially operating. I'll stop there for now. Thank you.
I'm going to invite Minister Samuda to come and give us an update on the rest of the school term. Minister Samuda, we're so happy to see you.
Pleasure to be here this evening, Prime Minister. Prime Minister, first of all, I want to introduce this press conference and the folks listening to the team of ladies that accompany me here tonight. Dr. Kassan Troop, our acting CEO, Ms. Adonia Chin, who is my right hand and my left hand, Ms. Carleen Brown, our communications director. Prime Minister, we have done in breakout ATA. We have met and we have reviewed the policies best able to guide us constructively as we go towards the opening of school, which will be in September. Before, I would just like, since the Minister of Finance is here, I'd like to remind him of the amount of funds that he makes available to us in the ministry. Our total recurrent budget is $115.039 billion, and the capital budget is $1.5 billion. It is within this context that we are determined to use these funds constructively to ensure that we do not overrun our budget and that we do not allow this outbreak to in any way frustrate the efforts of those hard-working members of the team that make such a wonderful contribution to the development of education in the country. It is important to put things in context, Prime Minister. And in summary, the Ministry of Education is responsible for four primary categories of students. Students at the pre-primary level, the primary level, the secondary level, and the tertiary level. The total institutions that we have to work with, monitor, and support amounts to 2,941. And the enrollment, the total enrollment through all of these various areas within the ministry amounts to 557,000 children. We have a total cohort of teachers of 32.6 thousand. So you can see by any stretch that this is quite an extensive ministry that has a lot to do with many, many people, many professionals who give of themselves selflessly in pursuit of the education of our children, something so critical and vital to the development of Jamaica. In addition, approximately 31,000 children have had, unfortunately, to go through this period without being able to be connected through the internet, which was our hope when it first started, that we would be able to connect with these children. We have not been able to connect with approximately 31,000 of them because the facilities are not available in the areas where they live. We had planned for schools to physically reopen in June 1. This will not happen, Prime Minister. Online and distance learning will continue until July the 3rd. Schools will not physically reopen until the next school year beginning on September the 7th, 2020. There will be a process of assessment and learning for the first 20 days after school reopens so that we can get a good feel for the level at which each child is, because they have been denied, many of them, an opportunity to experience the classroom environment. So we have to reintegrate them, in a sense, re-energize them, make them as enthusiastic about school as they were before this outbreak. The examinations that usually at this time of the year determines the placement of students from grade 6 into high school, grade 7, we will use, instead of the PEP in its classical sense, we will use aspects of it to determine how to place the children. We will use grade 4 numeracy and literacy exams done in 2018. Grade 5 performance task, which comprises maths, English, arts, social studies, and sciences, which was done in 2019. We will, in addition, use the results of the grade 6 ability test done in February 2020. And we will use these grades to determine the placement at the secondary level. We recognize that it is not a perfect world anymore. And we recognize that it is not as scientifically based as was the previous year. And we are expecting that it will return to normalcy next year. But this year, we cannot do anything that will compromise the progress for our children. So we are going to use this technique. And I might add that it has the full support, to my certain knowledge, through connections through the internet with all interests in education and at the level of the President, Mr. Owen Speed of the JTA. The placements will be released on June 26, 2020. We are already advanced in the preparation of those placements, but we have to make sure that they are properly checked and cross-checked and assessed, and they will be released on June 26, 2020. The end of secondary exams. The examination bodies have proposed the following. With respect to the CXC, assessment for late June, July, or September, October. The administration of multi-choice papers, either online or by paper base, will be the method used. A final decision will be made at the CARICOM heads of government, at which the Prime Minister will attend and will help to determine the final, virtually, and will finally make the decision, and you'll be guided by that decision. With respect to the City and Guilds examinations, the proposal is to use calculated results. This will include teacher assessor estimates, grades and judgments of the results. Students, approximately 30,000, will participate in this assessment. And this has their full agreement and support. The National Council on Technical Vocational Education and Training, the NCTVET, the proposal is to use online testing of the theoretical component of the assessment. Students approximately number 18,000. Whilst we have negotiated subsidized plans from Digicel and Flow for all teachers and students, we know there is still much more to be done. We cannot continue to have a situation where approximately 30% of our cohort live in areas where they have no internet facilities, and that poses a threat to them. And we have spoken to the teachers in those areas several times, and we are making every effort to ensure that we cover those areas thoroughly. There are currently 238 schools in remote areas without internet access. The aim is to have these 238 schools served by Ready TV, that has come forward and put together a very constructive plan, which has now been put in place, and they're about the business of accessing those, allowing those communities within that area, 100 to start with. Installations are to begin on those first 100 this week. So at least by the end of this week, I'm expecting, or within, let us say, 2 weeks, we will have access in these 100 communities, which will be a tremendous relief to the teachers and the students alike in those areas. In addition, recognizing that we need to step it up in technology, the teachers, we distributed the tablets which were part of their agreement with the Minister of Finance, and that will commence tomorrow. Over 5,510 are now available for distribution. E-learning will provide 40,000 tablets for children to assist them when the lectures are sent to them, downloaded, and they're able to work with these tablets. Gone are the days when we consider tablets luxuries. It is a tool as much the same way that years ago a pen was. 1,195 in student tablets are available, and 2,000 being cleared as we speak. The distribution will start by the end of May, so the kids and the teachers have a lot to look forward this month. The ministry is currently procuring an additional 7,000 tablets for needy children, children that need special attention. So we're not leaving them out of the loop at all. This is an all-embracive strategy. And tertiary level institutions will make their own decisions regarding closing the current year and the beginning of the next school year. Thank you, Prime Minister.
Thank you, Minister Samoda. I'll invite Minister Johnson-Smith to give the update on the re-entry of Jamaicans. Minister Johnson-Smith.
This takes a bit of time. The new normal. Apologies. Thank you. Thank you, Prime Minister. Good evening, everyone. I want to start also by adding my voice to the appreciation expressed by the Prime Minister earlier to the Amber Group of companies for the incredible work that they have done in creating the Jam COVID website and apps. As far as we're aware, it's the first end-to-end COVID response immigration software, and we are extremely proud that Jamaica is on the cutting edge of technology in this regard. It has inbuilt health screening as well as immigration health screening, and has really been prepared in record time when you consider what goes into the development of software and websites. Just up to a couple hours ago, we had 4,682 applications received, and this after only having been launched for 1 week. The feedback on the experience has largely been positive, and we've had 687 mails, inquiries, and have answered 596. The biggest issue for most people, of course, is when will their approval come through, followed only, of course, by a close second to ask, when can they come home? It's probably therefore important that at this time I remind everyone that we are still in a global pandemic. Persons coming home are returning from high-risk jurisdictions, so we have to make sure that their return is undertaken in a managed way. As we've stated before, this means that we will only return those numbers of persons that the health authorities confirm that we have sufficient quarantine and isolation facilities available. So as you would imagine, we are preparing for the receipt of our first COVID-2. The government has been working continuously on this matter to ensure that we achieve the best result for our nationals and for our country. Through our Jamaica High Commission, together with the Ministry of Tourism and their agencies, my ministry has been collaborating, and discussions have even reached as stated, I think, 2 press briefings ago. We were looking forward to welcoming dated April 23rd. It, however, required a significant amount of further work for us to get to where we are today. And where we are today is that we announced that on Wednesday afternoon, by way of TUI Charter, we will welcome home from the United Kingdom 115 Jamaicans, made up of approximately 75 crew members, including the 43 of the Marella, but from 6 other ships owned by the same cruise line. The additional 40 will be comprised of Jamaicans stranded in the UK who have been affected by the global pandemic in different ways, and who have been in touch with the High Commission or with the ministry regarding their particular challenges. We are also working on a cohort from the United States, and again, we are focused on persons who are having the most challenging of circumstances. It is in this context that I think it might be important, Prime Minister, for me to clarify that state quarantine, which is mandatory for persons returning, it is the policy at this point in time, is not free to taxpayers. It comes at a negotiated cost of 100 United States dollars per day per person, inclusive of accommodation and 3 meals per day. I know you'll agree that this is a significant cost to bear. I know you will agree that at this time, it is important for our nationals who are experiencing challenges overseas to come home. And this is the compromise now being struck, balancing the rights with, of course, the public health risk. It is in this context that people have been asked within the framework of the Jam COVID app to make a contribution of $20 per day or to make family arrangements in respect of meals. It is, however, decided and has been decided by the Cabinet that in recognition of the particular challenges, the particularities of this week's arrivals and the circumstances under which they have been operating over the past 2 months, that the government will absorb the full cost of state quarantine. So this week's arrivals will be supported in their entirety by the Jamaican government. The cost of this will be approximately $64 million. This is a significant cost and one not to be downplayed. It is not, you can't put a dollar figure on the importance of our nationals, but we are recognizing that it is time and we are doing our part to have them come home. We are seeking to accelerate work on the protocols for home quarantine, but we trust that the public understands that even with home quarantine, and perhaps more so, there's a risk quotient that has got to be managed. Even with the appropriate technology, it will require health and security resources for home assessment and for health monitoring. After all the hard work and sacrifices we've made, after all this, the input and daily work of our health authorities, of our frontline workers, we can't get impatient at this stage, rush headlong, and overwhelm our public health system. We have to act wisely, responsibly, managing the risks. And perhaps in this context, I can touch very briefly on the matter of the cruise ships. It's an emotional matter, and accordingly, one which I know tends to occupy a great bit of attention from the media and the public at large. So I would like to just update on the numbers of Jamaicans on different cruise lines who have either indicated formally or informally that they would wish to repatriate nationals. The Disney Line, 215 Jamaicans. The Holland America Cruise Line, 37. Carnival, 342. Norwegian Lines, 130. Royal Caribbean Cruise Lines, 1,349. The San Nazaire Line, 37. MSC Line, 31. Exmar, 22. And there are 2 ships in Brazil with 10 Jamaicans between them. These are the ones which have made contact. It is important for us to recognize that the Jamaican government is in discussions on these matters. We recognize the importance of bringing our nationals home, and we are grateful for the ship's recognition of their obligation to take care of our nationals while they are on their ships and subsequent to their contractual arrangements till they be returned home. We're committed to working with them to find the best solutions, but ask Jamaicans to be patient, to be understanding, to remember that we are all in a global pandemic together, and accordingly, timing is important. We will be meeting internally as early as tomorrow to have further discussions about processes, and Minister Chang, who is the Minister of National Security, will be corresponding formally with the cruise lines as well regarding our current situation under the Disaster Risk Management Act and our understanding of the obligations of cruise lines under the relevant international conventions. With that, Prime Minister, I thank you.
Thank you. Thank you, Minister. I'm going to invite for 5 minutes the Minister of Finance to give a brief update on the CARE program. 5 minutes.
Thank you, Prime Minister. Just to give an update on the CARE program, and in particular the payments being made under the program. As I would have shared recently, over the past week, persons who applied for compassionate and set cash grants would have been receiving text messages and email messages to confirm their eligibility status. As you know, approximately 400,000 persons applied for the CARE program's compassionate grant. Between April 24th and Friday, approximately 380,000 of that number, or 95%, have been verified as eligible, and this has been communicated by text or email to those 380,000 applicants. Of this number, approximately 150,000 would have applied to be paid via a remittance company, and the remainder, approximately 230,000, would have applied to be paid via bank accounts. All those who have been determined to be eligible to receiving a compassionate grant, who elected to be paid by remittance company, those payments are being processed as we speak. Well, clearly not after 6 o'clock, but being processed at this time. We have had, however, with respect to the bank accounts submitted, a large number of bank accounts that have been unable to be verified as actual bank accounts in the name of the applicant. And that challenge with the bank accounts is over 50%. Just to remind applicants that the bank accounts that are submitted with an application for a compassionate grant has to be in the name of the applicant of the compassionate grant. There are many instances where persons have submitted a bank account in their parents' names, in their grandparents' names, or in their child's name, or in their uncle or their aunt. For purposes, money laundering and KYC purposes, the government cannot transfer money to applicant John Brown to the bank account of Wayne Smith. The name on the bank account has to be the same as the name on the application. Now, the good news is that anyone in that category will be notified by text message this week, and a message will say that the bank account you submitted is not a verified bank account. You'll have the opportunity to go on the online platform at www.wecare.gov.jm and click on the check the application status, and you'll have the opportunity, once you do that, to update your financial institution information. At that point, you can either re-enter a bank account in the name of the applicant, or you can elect to have the payment be directed to a remittance company of your choice. Having said all of that, approximately 250,000 applicants for the compassionate grant have been determined to be both eligible and with a bank account that has been verified or with payment directed to remittance companies. The instructions for those 250,000 have been received by the Accountant General's Department and will be paid in the usual fashion that the government of Jamaica makes electronic payments. The batches will be processed, or the amounts will be processed, or the payments will be processed in batches of 1,000, which will be uploaded to the electronic payment system through the Bank of Jamaica, and payments will be remitted thereafter. This represents the largest pool of electronically transmitted funds from the government of Jamaica through its payment portal. On a monthly basis, the most number of transactions that the government or through the Accountant General's Department effects to customers and employees is in the range of 60,000. So you can sort of understand processing 250,000 payments comes with its degrees of complexity. Having said that, however, the payments should be with the remittance companies and the bank institutions by Tuesday, going into Wednesday, and available for beneficiaries by the end of this week. Just to remind those who will be collecting from remittance companies that you need to present a government-issued ID along with the application reference number in order to collect. And I'd ask you to listen out to the advice from the remittance companies, who I believe will be coming out shortly to advise customers on how to collect the compassionate grant once it's in the possession of the remittance companies, so as to abide by the government of Jamaica's health guidelines, and in particular the social distancing measures. Thank you very much, Prime Minister.
Just made it. All right. I believe we could now take questions, if there are questions from our online audience.
Yes, Prime Minister, thank you so much for that and for the briefing. Ahead of your briefing on a regular basis, we do encourage the media to come on early and ensure that we have a very clean feed going forward, which includes the audio and video quality. Our first question comes from Althea Saunders from the Jamaica Observer. Althea? Should be up momentarily.
Can you hear me?
We can hear you loud and clear. Yes, go ahead.
All right.
Please.
Good evening. Althea Saunders from the Jamaica Observer. Mike, I have two questions for Dr. Tufton. The first one is, Dr. Tufton, you said that there is a gap in the audit and inspection of private hospitals and the nursing homes in particular. Can you explain what that gap is exactly? How often are these inspections done, as opposed to how often they're supposed to be done? And the second question is, you also said the nursing homes do not meet, there are a number of nursing homes that do not meet the criteria for registration. Can you elaborate as to exactly what does that mean? What's the deficit or the gap there?
Thank you, Althea. Minister Tufton is conferring with the team from the Health Ministry.
Right. So thank you very much for that. And I'm being prepped here by our legal advisor, who has intimate knowledge of the nursing home legislation. My understanding is for 2 years, the license exists for 2 years, and audits are done within that time frame. Of course, one can audit at any given time depending on any concern that may be raised by the public, any concern that the relevant agency may have. So anytime within that period. However, as was stated publicly, I believe carried today in one of the daily papers, we have seen some gaps in terms of a number of those institutions not applying to be registered And there are a number of reasons for that. The agency within the ministry has explained concerns around enforcement, and the evidence of taking action to correct that is there in that new legislation is being crafted. What we have to do now is to advance that process so that the regulatory framework can be a lot firmer and the enforcement can take place. Thank you.
Our next question comes from Ms. Brittany Clark from the Nationwide News Network. Brittany, we're not hearing you. Could you try
Unmute
again?
your mic, Brittany.
Thank you. Hello, good evening again. Thank you very much. Does the Health Ministry plan to allow other facilities such as private medical labs to assist with the COVID-19 testing process? If not, why, given the backdrop of the possibility of a backlog in the event of a spike? Thank you.
The minister is being prepped by his CMO, but I could answer for him.
So, as was said earlier, the evidence of a more aggressive testing is there. We're close to 6,000 tests, almost doubling the number of tests in a relatively short period of time. We're moving to another phase now, as was announced some time ago, where the antibody testing, another type of test, will eventually be introduced into the population. And the discussions are now taking place at the level of the ministry as it relates to how those tests would be administered. So I'm not going to commit one way or the other at this point in time. I will await advice from the technicians, the clinicians. But what I will commit to as the policymaker in this field is that we will ensure that the tests are more widely available so that the population can have access. And I think that's the most substantive issue, not whether it is administered by one agency or another, or the private or public sector, that it is available. Thank you.
I think, Minister, this question has been asked in Parliament, and I have ventured an answer which is similar to yours, which is, this will become a standard test eventually, and it is about, therefore, setting the standards as to how these tests can be applied. The ministry is presently doing that, and I'm sure in short order you will see the standards being made public, and the protocols for onboarding private partners will be ready, and I think in short order.
Thank you, Prime Minister. Minister, we now have Mr. Damien Mitchell from the Gleaner Company. Is it Damien?
Thank you. My first question is to Dr. Tufton. With the revelation that Andrews Memorial Hospital is not registered by your ministry, will you be canceling the deal for it to take certain patients from the KPH? That's question one. Question two, has the government revised its position on the use of hydroxychloroquine in the treatment of COVID-19? If not, is there an explanation for the statement from the Indian High Commission released on April 29, announcing the donation of 4,000 hydroxychloroquine tablets to Jamaica under what it calls a united response to the COVID-19 crisis? And question three goes to Minister Johnson Smith. I heard you make reference to a compromise being struck in the return of the Jamaicans from overseas, but isn't it an obligation of the government to welcome its citizens from overseas? And there's one outstanding question from last press conference as to whether the government can indicate whether there was a suspected or confirmed case at the Administrator General's Department in Montego Bay.
All right, so I'm going to ask the Chief Medical Officer, with the permission of the Prime Minister, to speak to the issue of the cooperation with a particular drug, because I don't think I have the technical competence to deal with that issue. On the first issue, as it relates to Andrews Memorial Hospital, let me just say, firstly, that I don't want the impression to be created that these private institutions do not perform an important function in the wider population, and that there are no standards that we can depend on. And certainly, in terms of my public utterances, I was not implicating Andrews Memorial Hospital in any breach. As you know, there's an investigation that's taking place, and I think the right thing to do is to allow that process to take its rightful course. I was, however, making a more generalized comment, which is that the rules as we now have them, the framework for monitoring and for overseeing private entities is weak. There's a context which I sought to explain, and there needs to be corrective action, which we have all accepted. I mean, this started many years ago, well before my time. What I'm committing to doing is to bring it through to its final conclusion. So if it is therefore, in direct response to your question, that we're not suggesting that these institutions don't serve a useful purpose, then clearly I would not be motivated to discontinue an arrangement that actually adds value to the COVID fight, despite the need that is recognized for moving into a more tidy system where we have a regulatory framework to oversee and ensure consistency of standards. I'm going to ask, if, with your permission, Brian, the Chief Medical Officer speak to the issue of the drug.
Hi, good evening, everyone. No, we have not changed our position in terms of hydroxychloroquine being used in the management of COVID. However, we are extremely grateful to the Indian government for the donation, which will alleviate any shortages that may come about with regards to the treatment of our other patients who are on hydroxychloroquine.
Thank you. The Minister of Foreign Affairs as well.
Oh, Minister Johnson-Smith is
indeed
making our way.
I
have a different mask for you, Minister. It's a more convenient one.
Thank you, Prime Minister. The question, Mr. Mitchell, good evening. It was about my use of the word compromise. So the Jamaican government has never resiled from a recognition of the right of Jamaican citizens to return home. But it must always and has always had to be balanced against the public good of the public health of the entire population of Jamaica. This is why that decision has been taken by governments across the world. It is a balancing of the individual right against the public right also to be protected in terms of good health policy. So perhaps I'll use the word balance next time.
Thank you, Minister. I believe Mr. Mitchell also had a
the
question.
Administrator General question.
Yes, in Montego Bay had announced
the CMO is indicating, and the Permanent Secretary, that there is no case, or you're not aware? They're not aware, but we will dig deeper just to be sure. But at present, they are not aware.
Thank you so much, Prime Minister.
For the Administrator General case of which you mentioned.
Thank you, Prime Minister. Let's move to our next questioner, Ms. Zara Burton, 18 degrees north. Ms. Burton.
Hi, good afternoon or evening. My questions are for Minister Kamina Johnson-Smith and also for Minister Tufton. Minister Johnson-Smith, can you break down, first question, the $64 million that you just spoke about that it would cost the government to quarantine the individuals coming back? Is it all the individuals coming back this week that will amount to 64 million? Or is it just the 40 something from the Morello? So if you could break that down, that's question one. Question two for you as well, please, is on the issue of GPS tracking. I was reading a Loop News article that spoke to the GPS app or something similar to that not yet being ready. And the thinking, I think, was to track these individuals who are in quarantine. Will these individuals be tracked using GPS, the ones coming back this week? Were the individuals that came back from Antigua also, are they being tracked by GPS, and what is the legal framework on which you rely to track these individuals? And then for the Minister of Health, Christophe Dunn.
Maybe I could answer, and then so that if you don't mind, just for our effective note taking and response.
Okay, go ahead.
Thank you, very kind of you. All right, so the $64 million, the approximately 64, is the full cost of the $100 a day for the estimated 330 people that we anticipate to be returned to Jamaica this week. So it would include the 115 from the UK, and as I explained earlier, we're also working on receiving a cohort from the US. And it's a negotiated package for room and food, 3 meals a day, plus room and all of the sanitation and costs that go therewith. So it's 100 times 14 times 330 times the approximate US dollar of 145, if I can pull for that number. Well, what I have not mentioned are the other logistical costs, the cost of the security forces to transport them there, the testing, the health monitoring that takes place, the temperature taking every day at the appropriate times, the logging, the monitoring to ensure that if there is in fact any development of symptoms, that the person is then moved to isolation facilities. It's all of the costs that go into ensuring that there's an end-to-end process, not to mention all of the prep work that's taking place now to receive them. Those are not covered by the 64 million. That's simply the cost of accommodation and food per day per person. Regarding the Loop article, I didn't read it, but someone had sent something to me about Loop, about the article having said that I said that the GPS tracking feature of the app was tested on the people in Antigua, etc. And it's absolutely false and misunderstood, I will say. And I tweeted to that effect earlier this week. The fact is that I spoke of the use of technology to help move us towards having a protocol for home quarantine. So the ability to track, as is being used across the world, to rely less on the manual process, which we currently have in place, where the public health worker has to go and find each and every person and interview them and tug their memory to ensure that they can epidemiologically track and geographically track their steps and who they engage with, who they were in the taxi with, who they were on the bus, etc. So we are working on technology as part of our Jam COVID functions to allow for that. But we are not there yet, which were my exact words back then as well. So nobody from Antigua was tracked. Nobody in quarantine now is tracked. Nobody coming in this week will be tracked, so far as we're aware. I hope that covered all of the aspects of your question regarding tracking.
Thank you. Thank you, Minister. I believe now there are some questions for Minister Tufton. Ms. Burton? Ms. Burton?
Am I being heard still?
Yes, go ahead, please.
Okay. The majority you just mentioned of the cases, 221 are related or linked, rather, the words, to the workplace cluster. But again, when I look at the overall number, I think we said 471, 221 isn't majority. So I was just curious, again, calculation-wise, how could you break that down for us? How is it that it's still the majority of cases that we've had to date? And also, could you go a step further? Because what I've been noticing is that sometimes when the count comes out, I'm seeing where there are a number of them that are under investigation, and I think 5 or so were linked to St. Mary yesterday. Are you seeing any kind of trends emerge from these under investigation categories?
Right. So in regards to the first question, the workplace cluster link has two components. It has the employees, so the direct links, and then there are the indirect links of the actual entity. And these are the contacts. So the contact tracing involves significant follow-up to where these persons reside, who they live with, who they have been in touch with, and the risks that may have caused, which subsequently, in a number of cases, has led to positive tests. So the total numbers from the employees and their contacts is just over 300. 305 or 301. So that would definitely make that a majority, over 60% of the total numbers linked to that workplace cluster. As it relates to the other cases, I had indicated in my presentation that we are now observing cases that are coming up through our respective monitoring sites throughout the country. These are persons who are turning up in our health centers, in our hospitals with symptoms and who are subsequently tested and are positive. And that these individuals do not have direct links to travel history or to a positive case. And that's the phase now that you describe as community transmission or community spread. I did indicate that we have seen some 36 or thereabouts, 36 cases to date that are linked to that kind of presentation. And it's an increasing number each week. And that is a pattern in and of itself, in that it represents the community transmission. And which is why I'd emphasize that the surge that we have seen from the workplace cluster is not the surge that we have been referring to as it relates to the community transmission, but we're now seeing some evidence of that. And we will continue to watch that. Thank you.
Thank you, Minister. Let's move on to Mr. Edmund Campbell from the Gleaner, and I have two reporters as well who noted that they have just two other questions for us. Mr. Campbell, go ahead, please.
Thank you. Prime Minister, when the CARICOM heads discussed the CSEC and CAPE exams, that is the timeline, does the Jamaican government has a preferred or a particular position as to when they would want to see these exams be taken? The second question would go to Minister Tufton. Recently, we heard that one deportee tested positive for coronavirus. Could you tell us if there have been any additional developments in relation to the others? Are there others?
Edmund?
He's seeing you and hearing you, Minister.
Edmund, you're not hearing me.
He can, sir.
Edmund, that's a highly responsible group of people that every year make their recommendation in light of the challenges that the entire community has been confronted with. They are busy about the business of determining what is the most appropriate time for them to hold that examination. The CARICOM minister, especially the one I spoke to in Trinidad, the Minister of Education, has indicated that his position accords similarly with ours, that it should be put off for the heads to determine specifically what's the most appropriate thing to do this year, being an unusual year. You have anything else?
Well, Edward, you will see the diplomacy in the answer. In other words, we can't disclose what we're going to do before we get there. Obviously, for strategic reasons, but we have considered it, and we always want to give our students as much time as possible. I mean, I think that would be the appropriate signal. And your second question?
Yes, Edmund, go ahead with the second one.
The deportees.
Okay, so I'm confirming that only one, the one that we announced, tested positive. The others have been negative to date. Today represented the final day of their quarantine period, and they're going to be subjected to an additional test, and then at which point, of course, depending on what arrangements they have with the state or otherwise, they'll be dispatched accordingly.
Thank you. Prime Minister, it is now 20 minutes past 7 o'clock. We have three final questions for you. Let's go back to Ms. Brittany Clark from Nationwide.
Hello, good evening again. This question is for the Finance Minister. Last month, ratings agency Fitch said the COVID-19 pandemic would interrupt the strong downward trend in Jamaica's debt to GDP ratio. Now, during the budget debate, Dr. Clark projected that the debt to GDP ratio would dip below 84% at the end of the fiscal year. Now, is this still attainable? And what, if any, impact will the country's implication, or rather application, to the IMF's rapid finance instrument have on the country's debt to GDP ratio target? Thank you.
So as we have discussed, the COVID pandemic is expected to deliver a massive economic shock to Jamaica. Various international bodies who follow Jamaica have estimated that GDP could decline anywhere in the region from 3% to 5%. A decline in GDP of that nature would mean that revenues would also decline significantly. And revenues would decline significantly at a time that we have costs to attend to with respect to health and social support. So it's suffice to say that, debt as measured as a percentage of GDP, right? If your GDP is going to decline by 5%, then clearly your debt to GDP ratio is unlikely to decline, right? The debt to GDP ratio, as the denominator gets smaller, your ratio will get higher. And when you compound that with declining revenue base and increase in expenditure, it would accelerate that even further. Suffice to say that in the table of the supplementary, we will provide full updates on all of those metrics, and we'll be able to answer even more detailed questions at that time. But I hope that this answer suffices for now.
Thank you, Minister. Our penultimate question, Ms. Althea Saunders, the Jamaica Observer. Althea, go ahead, please. I believe your microphone may be on mute. You could unmute it.
Okay, are you?
We're hearing you now. Go ahead.
All right, great. This question is for Minister Johnson Smith. It's just a clarification I wanted on did you say that the Jamaicans who will be coming in after this week will be asked to pay $20? Can you explain that some more? What exactly will they be asked to pay for and so on?
If I may help out Minister Johnson Smith, who I believe answered clearly in the first instance, but just so that we're all clear, the cost to the government of Jamaica for the re-entry of Jamaicans who want to come home is estimated at about $64 million for this phase, which would be the 330 Jamaicans which we are budgeting for. Now, I want to make the point absolutely clear that we do not place a dollar value on our citizens. They have a right to re-enter Jamaica. We have to balance their right of re-entry with the right of the citizens who are here as well to their public health and the proper management of their public health. What we have said is that we will start by looking at the hardship cases first, and there are other areas that we will look at to determine who would come in, various exceptions, but generally we look at the hardship cases. So the first set that are coming in would be considered under the general rubric of hardship cases, and therefore the cabinet took the decision that the entirety of the cost would be borne by the Jamaican taxpayers. For others coming in, we would ask for a contribution of $20 out of the $100 which we estimate to be the cost per room and food going forward. Now, to be clear, this all depends on what we are able to negotiate. Sometimes it could be higher. Now, the government of Jamaica has to look at almost 5,000 persons who have applied to come in, plus those that are on cruise ships which have not yet applied. So you're seeing that number growing. So the government of Jamaica has to also be fiscally responsible and figure out how are we going to absorb the cost of state quarantining a large number of Jamaicans. The question is then, why not put people in home quarantine? And that question is currently being discussed and policies being developed around that program. But I want Jamaicans to understand the management of risk. We are now operating under what is called the Disaster Risk Management Act. What are the risks involved? There are significant risks involved in bringing in a new population into the island and having them dispersed right across the country to their various addresses. I want you to appreciate that in the instance of the workplace, we were able to identify a cluster. And in managing that cluster, we had to go and identify all their addresses. That was, tremendous work. Then some of those persons who were infected in that cluster, we had to extract them from the community and place them into isolation. And those who were in the workplace, we had to take some of them and place them in quarantine. We had to literally move them out of the community. And that was what was involved in managing that cluster. Now, can you imagine if we allowed general re-entry of 5,000 Jamaicans coming from 64 countries so far we have seen in areas that are highly vulnerable jurisdictions, that they have high cases of the corona COV2 virus. And then they're just generally in the population, not necessarily observing strictly and faithfully the quarantine rules, the challenges that could pose to our health system. So we have to manage that risk carefully. So we will start by controlled re-entry. We will develop the necessary protocols to be able to monitor, supervise, and serve, eventually, home quarantine. The resources to do that, we have to put them in place. We don't have those resources now. So can you imagine, if you are not able to police, that is to ensure that each home is checked, that people who are in quarantine stay in quarantine. If we are not able to do that and everyone is at large, you place the entire population at risk. So we are managing risks right now. And what we will be doing is to start in a phased basis with state quarantine, and eventually as we develop capacity to be able to manage home quarantine, then that will be available for everyone who wants to come back home. But we ask for the patience. I get the WhatsApps, I get the emails, I get the telephone calls. Prime Minister, please let me come home. Some are less polite. But the truth is that we have to manage the risk. And I totally understand the issues at play, but this is part of just trying to keep Jamaica, land we love, safe. We're not trying to deny anyone their right to re-entry. That is totally acknowledged, but we have to do it in an orderly way.
Thank you for that comprehensive response, Prime Minister. The final question then to Mr. Damien Mitchell, the Gleaner. You did say
Another
you had
positive case at a BPO.
Yes.
Are you hearing me?
Yes, go ahead now, Damien.
Right, so there was another case at another BPO. This is Conduent in Noggerhead, Portmore, St. Catherine. We gather that it is closed, but it would have been open at the point at which the employee would have contracted the virus. I'm trying to find out exactly how the Ministry of Health is handling that one.
Well, the CMO is going to come and answer you. But I also have an brief update on BPOs.
Okay, thanks for the question. So the Ministry of Health is approaching this case in just the same way in which we approach others in terms of our contact tracing, identification of close contacts. So far we have identified 34 close contacts of this worker. We have tested those and they are all negative. We go on to another round of testing tomorrow morning to ensure that we are not missing any persons within that loop. Thank you.
Damien, thank you for that question, because it, in wrapping up, I think we've done it in record time, but very quickly, the BPO sector is a very important foreign exchange earner for Jamaica. And we have to manage this industry very carefully. It employs 40,000 Jamaicans. It is the third largest employer in the country, and the third largest foreign exchange for us as well. So this is not an industry that we can see destroyed. To that end, therefore, we have put in place a task force, which I have asked Minister Vaz to head, and he has done an excellent job in bringing together the stakeholders and the management, all the supervisory agencies, the regulatory agencies, including the health inspection team from the Ministry of Health. And they are now conducting inspections of the BPOs right across Jamaica. They have sent me a brief report. I will deliver that report in Parliament tomorrow. But I want to also say that, yes, one workplace cluster has accounted for more than 64% of the cases in Jamaica. But I believe at this point, we would have largely contained that. It could have happened to other high concentration, closed environment employment situations. The important lesson is for us to put in place the strict measures. And I'm confident that the measures we have put in place and the regular inspections that we're now doing, which are going to be at a much higher level, will place the industry on a strong footing post-COVID to be a destination for business process outsourcing business, to make Jamaica a robust and solid destination for that industry. I think the measures that we are putting in place now are going to be higher than world standard. I think the industry, I met with the industry leaders on Friday, or was it Thursday? I believe it was Thursday I met with the industry leaders, virtually, that is. And we had a very good meeting. It is clear to me that they understand the threat that the COVID-19 pandemic poses to them. I think they understand that a lot rests on their management of the facilities and the faithful implementation of the standards. I think they have a great deal of work to do in educating their staff. They have moved much of their business off-site into work from home arrangements. And I think that that is growing. The government is looking to ensure that we have broadband fiber optic capabilities right across the island so that more BPOs can take advantage of both facilities and work from home. We have discussed that in our economic recovery meetings, that we need to make greater investments in that. So it is an industry that it's very important to us that in the crisis, it provides us with an opportunity to make the industry more robust, to make it stronger, and who knows, maybe to even expand the industry. Ladies and gentlemen, I want to thank you. I believe we've done it in record time, and we will try to keep this discipline. It's very hard to conduct cabinet and then come and deliver in the press conferences. But I think that the Jamaican people expect no less. Thank you and enjoy the rest of your evening.